Yeah, I coordinate the Butabika Link, which is a link between East London, NHS Foundation Trust, and Butabika Hospital, which is in Kampala, which is the major referral hospital for all of Uganda, teaching hospital as well for mental health. Yeah, I think it's become clearer and clearer over the years just how much people go through who have mental health problems in Uganda just to have the most simple opportunities that we take for granted and that other Ugandans might take somewhat for granted as well. Things like work and play, marriage, children, schooling. You know, people's children sometimes are mistreated within schools or given different opportunities because their parents have mental health problems. I mean, the list is massive, and one of our big aims is to, with service users in Uganda, to try and redress that on a local level. I'm conscious that with depression, there's something very hidden about depression in Uganda. I do remember early on in the link, I had a lot of young guys coming up to me on the quiet to sort of say, oh, you know, I have trouble getting out of bed in the mornings, I've got no energy, and there was so much shame attached to what might be an expression of depression because people weren't participating in the life of the community and the life of society as well, which is really frowned upon. So I think there's great opportunity there to come up with preventative ways to deal with depression and also use work and education opportunities to also propel people to better mental health as well. I think working in mental health generally, it's really important to engage with service users on their own terms. People experience a lot of stigma and discrimination as part of having a mental health problem that add an extra burden to having a mental health problem, and so engaging in a really meaningful way about how to change services so they're better with service users, empowering for them, and it's good for their mental health and it's also good for the quality of services. So it's a no-brainer really. Service users have to be involved in service development. There's such a long history of people with good intentions treating service users really poorly, and by putting service users in the driving seat, actually that gives a real opportunity to make a substantial difference to what comes out at the end. In a sense, it was really brave of the East London NHS Foundation Trust to allow a group of mental health service users from East London to go to Uganda and meet their counterparts, but what it did is it spawned this new organisation called Heart Sounds, which have really taken the lead in developing even a service within Uganda run by service users and acting as advocates for other service users. So that's one of the big successes. Our relationships are probably key, and that we've managed to build trusting relationships with our colleagues in Uganda. We've been really very clear about owning where we don't know something. We've been very clear about putting Ugandans into the role of expert rather than assuming that we know everything that's going on, and I think that's really led to the development of trust in our linking work. Over many years we realised violence within the inpatient setting was a reality for people, and Ugandan colleagues identified they could do something about it through their experiences in the UK. They were exposed to training in reducing aggression through how you respond, de-escalating violence and aggression when it happens. And so we created a project around that, and that project and that training has led to a group of Ugandan health professionals now being trained to do that training with their colleagues, and it's making a massive difference to people's inpatient stays. They're not being traumatised by violence so much now. One of our best programs is the development of peer support workers who are service users who are well, who are trying to provide a service in Kampala to people who have been recently discharged. So you've got, in a way, patients servicing patients. And the process of training those peer support workers is we're learning about their expertise they have and what they value. Peer support workers are a completely new group of workers. And not only do they get a benefit from providing a service, but they're also providing a service where it would not be otherwise, a community mental health service. And it also values the expertise of service users. So it's really a win-win situation in terms of capacity building. I think our experiences also with the anti-violence work, where there's a core group of trainers who are Ugandan, who've been developed and successfully rolled out their training to 100 other people, 150 other staff, really shows that if you train the right people in the right context and it's led and driven by our Ugandan partners, then it can really have a major impact on other people and ultimately on patients who need to benefit from the work that we do. In terms of working with traditional healers in Uganda, the key place that the Butabika Link has done that has been with psychiatric clinical officers, or PCOs. And PCOs are a group of workers that do a lot of the primary care mental health work around the country, both inpatient but in the community as well. And we've been helping seed some projects that they've done around consulting specifically with traditional healers so that they can cooperate around understanding each other's perspective, and PCOs helping traditional healers know when to refer people into official mental health services or formal mental health services as well. And Masaka and Mbarara are the two places that really excelled with that, who built very strong relationships with traditional healers. With 70% of people going to traditional healers before they go to formal public mental health services, it's really important to have those relationships. My personal highlight doing this work has probably been quite recently with the graduation of the first peer support workers in Uganda. Everybody was wearing these red t-shirts with peer support worker on them. They were officially welcomed in as volunteers within the hospital, given a formal role as official volunteers. They'd all completed a program of training, and they were really just having a great time that they'd been recognised and seen by the organisation. And the director of the hospital, Dr. David Basangwa, came along and he gave the certificates as a real vote of belief in them. And it's just such a change from where we started with the first service user groups at Butabika Hospital, where there was nothing formal happening in terms of asking service users their opinion, their view, and now they're providing a service. So it was just really moving. And later that evening, I think we all sang karaoke together, which was another highlight. I laughed a lot during that, so that was probably it.